This is a carry-on as I ran out of time on the first video, so this will be video 2. And this is about the muscular system of the major muscles. Pectoral major. The pectoral major muscle is a large muscle in the upper chest, running across the chest from the shoulder to the breastbone. Two pectoral major muscles, commonly referred to as the pecs, are the muscles that create the bulk of the chest. A developed pectoral major is most evident in males, as the breasts of females typically hide pectoral muscles. Next one is the rectus abdominis. I'm sorry if I said that wrong, but this muscle is located in the front of the body, beginning at the pubic bone and ending at the sternum. It is located inside the abdominal region. The muscle is activated by doing crunches because it pulls the ribs and the pelvis in and curves the back. The muscles are also used when a child is delivered, during bowel movement and coughing, breathing in and holding the rectus abdominis in pulls. Holding that in and pulls in the abdomen. Next one is the rectus femoris muscle, which is this one. This muscle is attached to the hip and helps to extend or raise the knee, raise the patella of the knee. This muscle is also used to flex the thigh. The rectus femoris is the only muscle that can flex the hip. Injury to the rectus femoris may result from overuse, as seen with kicking or sprinting related injuries. Inflammation of the muscle causes pain in the groin area during physical exercise that uses this muscle. The patient may experience pain during knee raises if the muscle is ruptured is torn, or inflamed. An operation may be necessary if the muscle is torn. Next, we're going to go to the erector spinae. The erector spinae muscle actually consists of 3 columns of the muscles. The iliacostalis and longissimus and spinals, each running parallel on either outer side of the vertebrae and extending from the lower back of the skull from the lower back of the cranium all the way down to the pelvis. The erector spinae provides resistance that assists in control action of bending forward at the waist, as well as acting as powerful extensors to promote the return of the back to the erect position. Next, we're going to do the bicep femoris. The bicep femoris is a double-headed muscle located on the back of the thigh, back of the femur. It consists of 2 parts, the long head attached to the ischium, and the lower and the back part of the hip bone, and the short head which is attached to the femur bone. The long head is part of the hamstring muscle group that accompanies the posterior section of the thigh. The hamstring muscle may be considered extensioners of the thigh. The biceps femoris muscle is important for knee flexion, internal and external rotation of the hip extension, not of the hip. Next one is the gastrocnemius. The gastrocnemius muscle is a muscle located on the lower portion of the lower leg, being one of the two major muscles that make up the calf. The other major calf muscle, the soleus muscle, is a flat muscle that lies underneath the gastrocnemius. Both the gastrocnemius and the soleus run the entire length of the lower leg, connecting behind the knee and the heel. A third muscle, the patellar muscle, extends 2 to 4 inches down from the knee and lies between the gastrocnemius and the soleus. Next one is trapezius, which is that one. The trapezius is one of the major muscles of the back and is responsible for moving, rotating, and stabilizing the scapula, aka the shoulder blade, and extending the head at the neck. It is a wide, flat, superficial muscle that covers most of the upper back and the posterior of the neck. Like most other muscles, there are 2 trapezius muscles, a left and a right trapezius, that are symmetrical. They are symmetrical and meet at the vertebrae column. Next is the latissimus dorsi, which is this one. And the latissimus dorsi muscle is one of the largest muscles in the back. Their muscle is divided into 2 segments, which are configured symmetrically. I don't even know if I said that right, but yeah. Along the backbone. The muscle is located in the middle of the back, and it is partially covered by the trapezius. It originates along the 7th thoracic vertebrae, T7, region of the spine, and extends to its insertion point on the humerus. And next one is the obliques. The external oblique muscle is one of the largest parts of the trunk area. Each side of the body has an external oblique muscle. The external oblique muscle is one of the outermost abdominal muscles, extending from the lower half of the ribs around and down to the pelvis. Its lowest part connects to the top corner of the pelvis, called the crest of the ilium. The bottom front of the pelvis, the pubis, and the linea alba, a band of fibers that runs vertically along the inside of the abdominal wall. Together, the fibers that runs vertically along the inside of the abdominal wall together the external oblique muscles cover the sides of the abdominal area. I think I may have repeated myself a little bit on that bit. I think so. Next one is the deltoids. The deltoid muscle is a rounded triangular muscle located on the uppermost part of the arm and the top of the shoulder. It is named after a Greek letter delta, which is D, which is shaped like an equilateral triangle. The deltoid is attached by tendons to the skeleton of the clavicle, collarbone, scapula, the shoulder blade, and the humerus, the upper part of the arm. Next one is biceps. The bicep is attached to the bone by tough connective tissues called tendons. The tendons that connect to the bicep muscles to the shoulder joint, in two places are called the proximal bicep tendons, and the tendons that attach to the bicep muscle to the forearm bones, radius and ulna, is called the distal bicep tendons. When the bicep contracts, it pulls the forearm up and rotates it outwards. Next one is the triceps. The main purpose of the triceps is to extend the elbow and straighten the arm. The triceps is located on the back of the arm and attaches to the upper arm, around the shoulder, and then again to the elbow. But it originates to the shoulder blade. The muscle works opposite to the bicep that is located on the opposite side of the arm.